Hello, Northford Hospital. This is Group 6 GCD Success, and I will be presenting our proposal on maintaining optimal functionality through utilizing a client and family-centered care approach. Today I will be covering our mission and values, alternative levels of care, strategies for change, project objectives, the effect of strategy implementation, and our performance measures and targets. Our mission is to utilize evidence-based research to demonstrate effective client and family-centered care in order to initiate an effective exercise programs to improve and maintain optimal functionality and wellness of our clients in the Northford Hospital and the larger community. Our vision is to improve and maintain the optimal functionality and mental wellness of Northford Hospital clients by implementing effective client and family-centered care within the interprofessional healthcare teams. The value of our team is the promotion and fostering of respect, compassion, innovation, equity, accountability, and non-maleficence. The management of alternative levels of care, or ALC, patients is a growing concern amongst many hospitals within the local health integration network, or LHIN. ALC patients are those who no longer are in acute care of their illness, however they still occupy an acute care bed while awaiting an appropriate alternative services. ALC patients create a complex, serious system issue within the Northford Hospital, which negatively impacts patient safety, access to care, and their quality of life. Northford Health Center has over 130 hospital beds that are filled with ALC patients who are waiting to be transferred to a long-term care home. The implementation of a patient and family-centered exercise program helps to maintain the optimal functionality as well as mental wellness of patients while in the hospital. This is an excellent strategy to reduce the Northford clients' functional decline and risk for institutionalization. The creation of individualized and client-focused care plans results in a better patient outcome, wiser use of healthcare resources, as well as greater patient and family satisfaction. Combining an exercise program and utilizing a client and family-centered care approach can also help reduce in-hospital costs and improve patient outcomes. Ensuring the maximum well-being of a client is achieved through focusing on client-centered care in the establishment of an exercise program, and this will increase the benefits and reduce chronic disease, which will prevent readmission, furthering resources and funding, as well as to help address the alternative levels of care issues within the Northford Health Center. The client and family-centered care model involves the patient families in their own healthcare decision and treatment. In order for a hospital to facilitate patient-centered care, the patient and family should be provided with the opportunity to become advisors within the healthcare setting. For healthcare workers, this can mean completing care with the client instead of simply for the client. Currently, Northford Hospital is not utilizing a client and family-centered care approach. The successful implementation of a client and family-centered care also includes creating partnerships among physicians, nurses, patients, and families and patients can educate healthcare workers on how they can work better with the patient, creating better healthcare outcomes. The implementation of a client and family-centered in-hospital exercise program has the potential to decrease disability and increase an individual's ability to care and sustain for themselves. Increasing an older adult's ability to care for themselves through the promotion of physical exercise in hospital and the encouragement to exercise once at home, in turn reduces risk factors associated with diabetes and heart disease and the need for additional in-home care services. It was estimated that $2.1 billion of the Canadian healthcare economic burden is attributed to the physical inactivity, and this emphasizes the drastic need to implement an exercise program to encourage a financially sustainable system. The reduction of a chronic disability impacts both the client as well as society. An exercise program that improves and maintains the function of an older adult reduces the direct and indirect healthcare costs within Canada. Our project objectives include analyzing the current client and family-centered care practices that are currently in place within the Northford Hospital Center, improving upon our current protocols and practices that implement patient and family-centered care, to critically examine current in-hospital exercise programs utilized within the Northford Hospital, the integration of in-hospital exercise programs into Northford Hospital care plans, and to increase the mental well-being and maintain the functionality of clients who are currently within the Northford Hospital care. The benefits of this strategy include reduced alternative care as well as the average length of stay for clients due to maintained or increased functionality and independence within the Northford Hospital. It also stops the permanent loss in the client's ability to perform their required activities of daily living through encouraging continuity of independence for the clients, reducing the need of alternative levels of care facilities or home care services. The enhancements of in-hospital patient functionality could also potentially eliminate the need for long-term care facilities. Another benefit is providing optimal discharge destinations and decisions and options for clients. And finally, improving upon the quality of care provided to clients within the Northford Hospital and maintaining functionality and independence of a client while they're in the hospital. This also provides the best plan of care and treatment equally decided upon for all members of the interprofessional healthcare team, including the client and their family. Along with benefits come risks, and the risks of this strategy include additional funds necessary to support exercise equipment and staff. Patients may become comfortable and reliant on a staff in a hospital and could become hesitant upon discharge. There must be education provided to staff on how to use these programs effectively. And there could also be a lack of collaboration communication to facilitate the appropriate utilization of these exercise programs within the hospital. Our performance measures and targets include reducing the revolving door effect of the patients within the Northford Hospital, and our target is 65% reduction. Also, we hope that our clients are physically more stable upon their discharge, and our target is 70%. We hope that there is high collaboration among all healthcare team members, which can include the physician, nurse, physiotherapist, and other team members, and our target is 55%. We also hope to provide satisfaction surveys to those using the exercise programs and have results showing high levels of satisfaction from these patients. Our target is 80%. We also wish that there is high levels of patient use within the hospital, and our target is 90%. Finally, we hope that we can get referrals from other hospitals for patients to come use our services that will later improve on their health, and our target is 60%. The GCD Success Group is confident in our strategies we have presented today. The implementation of this strategy will drastically reduce the ALC patients and improve their health care quality within the Northford Health Center. Here are our references. Thank you for your time and consideration of our proposal.